If you're over 60 and you've completely stopped masturbating, I want you to hear this before you assume it's harmless. Because as men get older, changes in sexual activity can be connected to changes in erections, hormones, prostate health, and even emotional well-being. And the biggest mistake is assuming every change is simply because you're getting old. I'm Dr. Aletha, and in the next few minutes, I'm going to show you 4 important things older men should know about this, and what you can do to protect your health. For decades, many men have been taught that masturbation is something they should leave behind as they get older. But reaching 60 or 70 doesn't mean your sexual health suddenly stops mattering. Your body still responds to circulation, hormones, nerve function, stress, sleep, and overall health. And when sexual activity changes significantly, it's worth understanding what else may be happening in your body. The first thing to pay attention to is erectile function. I've spoken with older men who suddenly realize their erections aren't as strong or as frequent as they once were. Sometimes the change happens so gradually that they don't notice until their morning erections become less frequent or disappear altogether. Your penis is a vascular organ, and healthy erections depend heavily on good blood flow and healthy nerve function. Regular erections help maintain blood flow and oxygen delivery to penile tissue. So when erectile function starts changing, don't automatically assume it's simply old age. Blood pressure, diabetes, high cholesterol, medications, stress, poor sleep, and cardiovascular problems can all affect erections. That's why a persistent change deserves attention. If your erections have become consistently weaker, look at the bigger picture. Stay physically active, maintain a healthy weight, manage your blood pressure and blood sugar, avoid smoking, and talk with your doctor if the problem continues. Sometimes sexual changes can be an early signal that your overall health needs attention. The second issue is testosterone. Now, you may hear claims that stopping masturbation causes testosterone to crash. The reality is more complicated. Testosterone naturally changes as men age, and levels can also be influenced by sleep, body weight, chronic illness, medications, and overall health. Sexual activity can cause temporary hormonal changes, but that doesn't mean avoiding masturbation automatically causes a long-term testosterone collapse. What you should watch for are real symptoms of low testosterone. Are you constantly tired? Has your sex drive dropped significantly? Are you losing muscle or strength? Has your mood changed? Have spontaneous erections become much less frequent? If several of these changes are happening together, don't simply say, "I'm getting older." Talk with your healthcare provider. A proper evaluation can determine whether testosterone is actually low and whether something else is contributing to the symptoms. And sometimes the solution isn't testosterone therapy at all. Improving sleep, exercising regularly, losing excess weight, treating an underlying condition, or reviewing medications can make a meaningful difference. The important thing is finding the actual cause instead of guessing. Now let's talk about something that concerns many men over 60, the prostate. You may have heard that if you stop ejaculating, your prostate becomes stagnant or dangerously congested. That's an oversimplification. But prostate health is absolutely something older men should pay attention to. Some research has found an association between more frequent ejaculation and a lower risk of prostate cancer, although that doesn't prove ejaculation prevents cancer. So don't think of ejaculation as a guaranteed prostate protection treatment. Instead, focus on the symptoms your body is giving you. Are you having difficulty starting urination? Is your urine stream weaker than it used to be? Are you waking up several times during the night to use the bathroom? Do you feel like your bladder isn't completely empty? Are you experiencing pelvic discomfort or pain? These symptoms shouldn't simply be blamed on not ejaculating. They can have several causes, including benign prostate enlargement, prostatitis, urinary problems, or other medical conditions. If these symptoms continue, get them checked. A urologist can determine what's actually happening instead of leaving you to guess. And then there's the fourth issue, your emotional well-being. This is something many older men don't talk about enough. Sexuality doesn't automatically disappear when you turn 60. Some men continue to have a strong sex drive well into their 70s and beyond, while others naturally experience much less interest. Both can happen. The problem begins when a man starts feeling ashamed, disconnected, or believes that changes in sexual function mean he's somehow lost his identity. Your worth is not determined by your sexual performance. But if intimacy, sexual activity, or masturbation are important parts of your quality of life, there's no reason to feel ashamed about that. Masturbation can be a normal part of sexuality for older adults, just as choosing not to masturbate can also be completely normal. There is no magic number of times an older man needs to masturbate. You don't need to force yourself into a routine because someone online tells you that you must. Instead, pay attention to your body. If you enjoy sexual activity and it isn't interfering with your daily life, there's generally no reason to feel guilty. But if your sexual desire suddenly disappears, especially alongside fatigue, depression, erectile problems, or other physical changes, that's worth discussing with your doctor. And this is the message I want every man over 60 to remember. Don't blame everything on age. Yes, aging changes the body, but many changes associated with aging are influenced by factors you can actually address. Your heart health matters. Your circulation matters. Your hormones matter. Your prostate matters. And your emotional health matters too. So start with the basics. Move your body regularly. Eat a balanced diet. Get enough quality sleep. Maintain a healthy weight. Keep your blood pressure, cholesterol, and blood sugar under control. Avoid smoking and talk to your doctor about medications or health conditions that may be affecting your sexual function. And if something changes significantly, whether it's your erections, libido, energy, mood, or urinary function, don't ignore it and don't be embarrassed to ask for help. You are not too old to care about your sexual health. You're not too old to improve your circulation, protect your strength, support your emotional well-being, or address problems that are affecting your quality of life. The goal isn't to follow some magic sexual routine. The goal is to understand your body, recognize meaningful changes, and get the right medical guidance when you need it. So if you're over 60 and you've noticed changes in your sexual or urinary health, don't simply tell yourself, "That's just aging." Pay attention, ask questions, get checked when necessary. Because getting older doesn't mean you're finished taking care of yourself. In fact, it means taking care of yourself matters more than ever. Medical disclaimer: this video is for educational purposes only and is not a substitute for personalized medical advice, diagnosis, or treatment. Always speak with a qualified healthcare professional about your individual health concerns.